Hi everybody, this video is to introduce the case study that you're going to be beginning today and something that we're going to be working with over the next week or two, maybe a little bit longer. It's a case study that happened in a hospital uh, in the days following Hurricane Katrina, which was a major hurricane that hit Louisiana, particularly New Orleans, and shut down the city, isolated people for many days. And there were some decisions made in a hospital that was essentially cut off from all aid and communication that in retrospect people evaluated and kind of broke down to look at the decision making process to try to figure out what had happened. And so that's what I'm going to ask you guys to do. There's a little introduction. I'm going to read it here for you. You can follow along with me. Um, but it says, the smell of death was overpowering the moment a relief worker cracked open one of the hospital's chapel's wooden doors. Inside, more than a dozen bodies lay motionless on low cots, and on the ground, shrouded in white sheets. Here, a wisp of gray hair peeked out. There, a knee flung akimbo. A pallid hand reached across a blue gown. Within days, the grisly scene became the focus of an investigation into what happened when the floodwaters of Hurricane Katrina marooned Memorial Medical Center in uptown New Orleans. The hurricane knocked out power and running water and sent the temperature inside above 100 degrees. And still, investigators were surprised at the number of bodies in the makeshift morgue and were stunned when healthcare workers charged that a well-regarded doctor and two respected nurses had hastened the death of some of the patients by injecting them with lethal doses of drugs. Mortuary workers eventually carried 45 corpses from Memorial, more than from any other comparable size hospital in the drowned city. And so the case study is going to have you listen to um, a podcast where they break down kind of what happened day by day and moment by moment. And as you listen to the podcast, I think it's helpful to see some images to help you kind of visualize what was going on. Um, this is Memorial Medical Center in New Orleans, and this is the flooding. So the flooding reached up well into the first floor, and that's where the problem came in. Because of the flooding, it shut out, not only was all the power shut out in the city for days, but it shut out the power in their generators. So they had no power in the building. And it essentially stranded them. There was really no way to get to them in or out, and there were so many other people in the city that were in need that the hospital and everybody who was there after the flooding were stuck there for days. Um, Here's some more scenes. Early on, there were some rescue attempts, and they did go in and rescue a few people right away before the full scope of the problems in other places started becoming apparent. There were a lot of people who were dying in their homes, and rescue workers prioritized helping them over helping the people in the hospital because the hospital was already full of some, at least, healthcare workers and had some resources. So here is Memorial Medical Center today, and you'll see here's the emergency ramp, and here was it during the flooding. So you can get a sense of just how flooded it was. There was a full, 6 feet of water flooding the whole first floor, and they were bringing boats in and out of what's normally an ambulance door to get some people out. And then throughout the video, they're going to be showing you and talking to you about how they did actually get some of the people out. And this little diagram shows the path that they had to take. And the scale here is difficult to comprehend. The Memorial Medical Center takes up a couple of city blocks. So this was well over a block or two of moving through the building, starting high up in the building and trying to get some of their patients to a helicopter pad, which they were getting some flights in and out starting on like the second or third day. And here's that helicopter pad they're going to talk about in the video. They're also going to talk about this little pass-through chute. It was like the only way they could get people from the hospital to this helicopter pad. And here's that chute during the outbreak where they were passing people from one side of the building to the other. There was no direct path because of the flooding to get to where they started. And then they were having to carry, here's 6-8 people carrying one patient up these rickety metal stairs just to get to the helicopter. So imagine having hundreds of patients in critical care situations and one patient at a time, this is the way you get them out. So that's a little bit of overview of the case study itself. Some background terms that you should be familiar with are listed here. They're going to talk about critical care and ICU patients. They're going to talk about DNRs, or do not resuscitate orders, which means patients who don't want to be helped if their heart stops. They're going to talk about ventilators, which are machines to keep people alive. They require electricity. They breathe for them when you can't breathe on your own. They're going to use the term euthanasia. So euthanasia is when you painlessly kill a patient in order to take suffering away, usually. And it's also just noted here that the sickest people in a hospital, including in this case study, are often being kept alive in part by machines that run on electricity. So when electricity goes out, it changes the equation for how we keep people alive. And you shouldn't assume that these people are going to die for sure. Just because you're hooked up to a machine, it might be that you're just hooked up to that machine while you wait for your body to heal enough to be taken off the machine. So we shouldn't assume that these people were going to die anyway. So you're going to click on this podcast, and then you're going to use this form to record some of the facts that they're going to go through in the case study. Remember, when we start talking about ethics and decision making, we got to consider, like, what are the facts that were made, that were used to make this decision. I have your notes divided up into time periods. They're roughly arranged in order of how they happened, but or of how they'll talk about them in the video. And again, they're also roughly divided up between the first and second day, and then between the third and fifth day, and there's some very different things were happening on those first and second and then third and fifth days. And I have the time periods here where you really need to be listening and taking notes. Your notes should be in complete sentences, although bullet points are fine, but thoughts should be complete. You want a good summary of information so you don't have to go back to this podcast later. Keep in mind, we're going to be using this as a tool and this information for a couple of assessments going forward and different activities that we're going to be doing. You can stop when you get to 34 minutes and 30 seconds. We'll be using the rest of the podcast for future lessons. If you listen to it, it's not the end of the world, but you don't need it for right now. You don't need to start listening till 8 minutes and 30 seconds. However, the first part kind of sets the tone for what the whole podcast is about, so I just listen to that. And you should just be taking notes, and you're going to submit this to the back to the assignment as a PDF when you are finished. And again, there's going to be a video attached on how to attach a PDF copy of a Google assignment. All right, good luck. Please message me on Schoology if you have questions, and